Hello. So this is questions every girl should ask her gynecologist. Chances are you've already consulted your OBGYN about some very important matters. You may have discussed the importance of getting regular pap smears to detect abnormal cells that could develop into cervical cancer. You may have discussed your birth control choices and your plans for having or not having a baby. Hopefully, you've also discussed the best plan for you when it comes to getting mammograms. You should definitely keep those issues in the forefront of your mind, but your doctor is also prepared to discuss many other questions with you. Don't be embarrassed to ask. Your doctor has seen it or heard it all. So, first question you should be asking is, what's normal when it comes to vaginal discharge? A clear or milky discharge is perfectly normal and healthy. It's your body's way of keeping your vagina clean by sweeping out old cells. It may get thicker when you ovulate or you're sexually stimulated. However, be on the lookout for changes in volume, color, or smell of discharge. If you notice these, contact your doctor. 2. What should I do for feminine itch and smell? For feminine itching or smell, don't reach for a douche. Persistent or intense itching may mean you have an infection, such as a yeast infection. Foul-smelling discharge could also indicate an infection, such as bacterial vaginosis or trichomoniasis. These infections require medication to clear up. Using a douche won't cure the infection. Instead, it could aggravate your already irritated vagina to spread infection to your uterus. 3. What's causing me to have horrible heavy periods? Heavy bleeding can be bleeding for too long, more than a week, or it can be doubling up on sanitation protection, or changing it often every couple of hours, even at night. This is menorrhagia. Depending on your age, it can signal that your body is gearing up for menopause. Your doctor may want to run some tests to rule out other problems like uterine fibrosis. 4. What should I do if I think I've been exposed to an STI? You definitely don't want to ignore the possibility of a sexually transmitted infection, also known as STDs. Left untreated, they can lead to serious health problems such as cancer or pelvic inflammation disease. What's more, some STIs don't have noticeably symptoms. If you're sexually active, ask your doctor about screening for STIs. The tests you need depend on your sexual history as well as your partner's. Be honest about it so your doctor has an accurate picture of your risk. Question 5. What could pain in my pelvic area mean? Pelvic pain can be a symptom of a variety of conditions, including both gynecological and non-gynecological problems. So this can be endometriosis, uterine fibrosis, scar tissue, or adhesive can cause pain. Or it could be a signal problem with other organs such as bladder or intestines. Question 6. Why does it hurt to have sex? If sex is painful, don't suffer in silence. Definitely talk to your doctor about it. There are a number of possible causes for pain during sex. Yeast infection can make sex painful for some women. Muscle spasms, dryness, menopause. 7. How do I know if I'm starting menopause? Menopause typically starts around age 50 or 51, but some women experience it sooner. You'll go through perimenopause first, a time when you may have irregular periods. You may have other symptoms too, like hot flashes and mood swings, as your hormone levels change. How will my desire for sex change as I age? Your sex drive fluctuates over the course of your life. It can be related to major life events or hormonal changes, but if it's been low for some time and is really bothering you, talk to your doctor. Your doctor may want to rule out other conditions that may be contributing to the problem. For example, depression can reduce your desire to have sex, as can certain medications. There are treatments such as hormone therapy and other type of medicines. So that's it for this. Those are just some questions that you should be talking to your OBGYN about. So thank you for listening.